As monkeypox continues to spread around the world, the United States has declared the disease a public health emergency. White House COVID-19 response coordinator Dr. Ashish Shah explaining the Biden administration's effort to tackle the outbreak.
There are 1.6 million people. There's no reason to think that 100% of everybody will want the vaccine, but we are going to try to target making sure there's enough vaccines for everyone. At 1.6 million people in the high-risk group, we've got 1.1 million doses already allocated to states. They can order it. About 600,000 have gone out. States are going to be able to get more this month. We've got another about 200,000 doses coming in September, another about 500,000 doses coming in October.
There are more than 7,000 confirmed cases in America. That's more than any other country. But it comes after the World Health Organization issued its highest alert over the outbreak last month. Globally, nearly 27,000 monkeypox cases have been reported across 88 countries, and Europe remains the region with the most infections. Joining us now is Dr. Hans Kluge. He's Regional Director of the World Health Organization in Europe. Dr. Kluge, fantastic to have you with us.
My pleasure.
We've seen the United States now declare this a public health emergency, but as you look at the infection rate that we're seeing, perhaps the lack of cases that we don't know we've got at this stage, has the response been swift enough and aggressive enough in your mind?
Well, I think that several lessons from the COVID-19 have been taken into account. So it's very important that there was a public health emergency of international concern. I would like to commend the United States government for having it now as a national emergency, because what does it allow? It's a call to action, and it allows to target resources to contain the outbreak. And that's the main aim that I'm here to for this transatlantic cooperation, because we see that a crisis anywhere can become a crisis everywhere if unattended, and both regions, just like COVID-19, are the epicenter in the world.
Can I ask about, and I mentioned it in my introduction, for all the cases we know about, do you have an estimate, even if it's a guesstimate, of how many cases that we don't know about? What kind of proportion? Because this is also a lesson that we learned from the COVID-19 pandemic, that for every case we know about, there can be multiple that we don't.
Absolutely. Speaking about the pan-European region, we have about 17,000 cases now. This is clearly the bulk globally, but we call it the tip of the iceberg. So two key issues here to limit the infection. Number one is to sensibilize the high-risk groups, and in the European region, like globally, it's mainly in the group men having sex with men with multiple partners. Very important to avoid stigma and discrimination, because otherwise people are going to go underground and will even have a lesser idea of the total number. And number two is to target the vaccines and the treatments to those high-risk groups.
Do you have a sense of a baseline level of how many people that you think will get infected, in the same way that we heard there from the White House's coordinator on COVID-19? They said that the high-risk group is 1.6 million people in the United States. They have 1.1 million vaccines available today. Do you have any kind of estimates for Europe, even if it's just the high risk, the proportion of people that are high risk?
Well, it's a specific target group, but it does not depend on sexual orientation, because what we're seeing now is also cases in children, in women as well. So basically everyone is vulnerable. But a key issue, I think the biggest thing to tackle, is the stigma and discrimination. And we should remember, after all, that the transmission is not so easy. It requires close contact, skin to skin, mouth to mouth. So in that sense, the calling of an emergency is very timely, because what we don't want, for example, is to have a reservoir in animals, in rodents, which then can really sustain the monkeypox outbreaks in the future.
Dr. Kluge, I think you said something incredibly important there about the stigma attached to monkeypox at this moment. And I think so far the message has been targeted to specific communities, and specifically men who have sexual intercourse with other men. And the message has been that they need to limit those sexual partners to try and avoid infection or spreading the infection. Are you saying actually that that's now the wrong message, and that everyone needs to be careful, particularly if we're seeing children be infected? And who should be vaccinated, and how do people best protect themselves, whoever they are?
On the vaccination, an important point here is that vaccines alone are not going to stop the outbreak. It's either what we call pre-exposure or post-exposure, and it takes about 2 weeks to build up the immunity. So it's a very important tool, but not a panacea. The key issue, frankly speaking, is the oldest public health tool that we have, and Portugal in my region has shown that you can have a decrease of the cases even in absence of wide vaccination by sensibilizing the high-risk groups. And for this, we need to empower trusted messengers and fight fake news and disinformation, which is a lesson we learned from the COVID-19.
Yes, so everybody needs to be careful here and
Yes.
be prepared and be aware, and it's not just specific communities that should be targeted, because to your point, that does raise the stigma attached to this, and I think we've unfortunately established that today already. I want to move on and talk about COVID, because I know you're also raising the flag about an increase in cases, particularly as we head into the winter months, and we're already seeing rising cases, and again, many we're not capturing because people, I think, are tired of testing. How important is it to time the message from governments and the response from individuals? Because I do feel there's a window where you can say to people, look, you need to wear masks again, you need to be more careful, but people are exhausted. And if we want to get this right, the timing on what we ask people to do has to be very targeted. Would you agree?
Absolutely. Basically, what we see in the European region and also globally is that people stabilize their lives, but without stabilizing the pandemic. The virus has never gone away. It's still there. It keeps changing, and it's still taking unnecessary many lives. So the key issue here, I would say, is surveillance, because information data is power. Several countries are weakening their testing strategies. They do not make a difference between reporting people going to the hospital due to COVID or with COVID. We developed in Europe 5 pandemic stabilizers. Number 1 is a full vaccination. Number 2 is the second booster for high-risk groups. Basically, if you haven't had your shot this year, you should consider yourself vulnerable. Number 3 is ventilation. Far not enough attention has been given to ventilation in classes, in office buildings. We don't want to close the schools again. Number 4, if need be, in confined, crowded places, to consider masks. Even now, I am wearing the mask. It's not because it's not obligatory that you should not consider it. And number 5 is to scale up equal access to the new antivirals to avoid people getting onto the ventilator.
Yeah, good messages, sir. Great to have you with us, and hopefully we'll talk again soon. Thank you so much for joining us. Dr. Hans Kluge there, the Regional Director of the WHO Europe. So thank you.